And then when you do a little bit more pressure, usually they're tapping into something because then they've had a connection to themselves and they have agency over this release. So there's this really special thing that happens. And yeah, something deep usually happens when we get to that point.
What clinicians are attempting to do is take all the leading trauma treatments and figure out what makes sense for them. Why not have Neuro-auricular be one of them?
A client who has severe dissociation and will come out of the window of tolerance very, very rapidly, and then it's extreme. Maybe we could talk to this, how neuro-auricular stimulation in a situation like this looks.
I've got a person who's similar to the person you were talking about earlier that has severe dissociation, like can't tolerate much affect at all, so would shut down, and she wouldn't go into the fetal position, but she would go offline, and it was like trying to communicate to someone who just couldn't hear you. So it became quite evident that active EMDR would shift her into that state. So we had to come up with other ways to be able to have some awareness of the trauma and also be able to process. So we introduced neuro-auricular pain memory points and psychotherapy points, and
we stimulate that point. Can we allow to see if that will actually help bring you back as well, so that then we can continue processing? Because that's what we're really trying to do as clinicians, is stay on this edge, not go over it, not be under it. If we're just in the social engagement system, we're not going to get anywhere, but we really need to stay on that edge. If we're over it, then we can spend lots and lots and lots and lots of time. How the things that we're doing aren't necessarily working. It's just that extra tool to help the client go, okay, down.
These sorts of points were really tender. There was a lot going on for this person. She was a heavy drinker, would drink to the point of blacking out and getting into really dangerous situations that would re-trigger what her history had been. So it was this constant cycle. But after that first session, she didn't drink for the first weekend in like 6 months or something. And that was just after one. So she didn't stop drinking. I'm not saying that, but that was the first time she felt enough stability to leave a session, go home, not drink when she would normally go home, wipe herself out. So that's a big, big indication that there's something coming back online for stability. So that's one of my really fond memories of helping someone get some stability back quite quickly.